And thank you to my next guest for coming in this morning, because we're talking about something that is really a growing disease. We're hearing more and more about it, especially from celebrities who are strong enough and open enough to discuss this. So we're talking about Parkinson's. And Dr. Hubert Fernandez is the director of the Center for Neurological Restoration at the Cleveland Clinic, and he's joining us today. Thank you for coming in.
Thanks for having me.
Pleasure to have you here. I think with any other disease, any other condition, the best thing for people to do is learn more about it, to talk about it. And I think what a lot of celebrities are, how they're opening up, it's really helping a lot of people to feel like they're not alone.
Absolutely, absolutely. Especially nowadays in Parkinson's disease, I tell all my patients that, you're going to live with Parkinson's for a long time. And so the best thing you can do is to learn about the disease. Knowledge is power.
So when you have patients come in for the first time, I mean, what are symptoms are there early onset symptoms that people might think are something else, but then they come to find it as Parkinson's? Because is it helpful to catch it earlier in the process?
Absolutely. So the challenging part about Parkinson's is that it affects different people in a different manner. Probably the most striking symptom of Parkinson is the tremor or the shaking. But the problem is not everyone with Parkinson's shake. So sometimes it could just be a little bit of slowness or a stiffness in the arm or a dragging of the leg or difficulty with handwriting. It's really not uncommon for our patients to be seen by a rheumatologist, by an orthopedist, physical therapist before they actually see a neurologist and get diagnosed with Parkinson's. Some are lucky, they get diagnosed very soon. Others go a different route and find different specialties and stuff before they get the real treatment that they need.
So forgive me, but the earlier you catch it, is it easier then to spread the time frame of the onset of a lot of the conditions? I mean, if you catch it early, does it help with how people are dealing with it?
Yes and no. It's not as critical as, say, cancer, where you need to spot that and take out the tumor as soon as possible. But in Parkinson's disease, it is a progressive disorder. It gets worse slowly over time. And so the sooner you intervene, even with simple treatments that are not medication, such as exercise,
That's what I was wondering. What types of treatments would that be?
All our patients now, they move. They gotta move. And so exercise is one thing we advocate, especially aerobic, fast-paced exercise. And then when the time comes that they're bothered with their day-to-day activities because of the slowness or stiffness or the tremor, then we have treatments for them. And even more when they go to a Parkinson's center, such as the one we have at the clinic or elsewhere. We now have a lot of clinical trials going on. And so they can participate in really groundbreaking treatments for Parkinson's. These are new medications we're treating that can slow disease progression, hopefully stop disease progression altogether. So it's an exciting time for us, and there's a lot of hope for our Parkinson patients.
That's absolutely wonderful to hear, and I think as long as you can have hope and you can have promise, it gives people a different mindset to be in. This is something that can affect very young people as well. This is not always someone who's aged.
Yes, the majority of Parkinson patients get it in their 60s, but 10-20% of them get it in their 40s or even younger. They're called young onset Parkinson patients.
So what would be the number one thing you want for anyone who might be out there thinking, there's a chance I have this, or I do have this, and how am I going to cope with this? What do you really want people to know?
Well, I want people to know that it's no longer a lost cause, that there's a lot of help out there for Parkinson patients. Get out of the closet, see your doctor, see a neurologist, and we'll explain the good news. I'd also like them to know that they should be open to new treatments and participating in research. This is what I do for a living, so I'm a strong advocate for it. And I tell my patients, the reason why we have 10 drugs to try on you today is because 5 years ago, your neighbor, your friend participated in a clinical trial.
Those clinical trials are crucial.
And the reason why we'll have even more treatments for your son, daughter, or neighbor is because today you participated in research. So hopefully they have an open mind to that too.
Well, we are thankfully one of the best cities in the world to have the Cleveland Clinic right here at our footsteps, and we thank doctors like you for helping us get through some, very difficult times and an initial diagnosis of something. So I appreciate you coming in, and
My
I'm sure there's so
pleasure.
much more to learn. So you can always give the department there a call if you feel the need to be seen by one of the wonderful doctors there. Thank you for coming.
Oh,
in.
you're welcome.